All right, we're going to go ahead and jump into another GI practice question for both your Step 2 CK, IM Shelf, and IM COMAT, and we'll go ahead and jump into it. Go ahead and read the question, pause it if you need. A 50-year-old male with a history of chronic liver disease secondary to alcohol abuse presents to the emergency department with hematemesis and melena. He is hypotensive and tachycardic. Physical exam reveals pale mucous membranes, abdominal distension, and signs of chronic liver disease, including spider angiomas and ascites. Laboratory tests show hemoglobin level of 6.8 and elevated INR and abnormal liver function. Urgent upper endoscopy reveals active bleeding from dilated tortuous blood vessels in the lower third of the esophagus. What is the most appropriate initial management step to control acute bleeding in this patient? So, as you can see in this question, the dilated tortuous blood vessels in the lower third of the esophagus, that's telling us we're dealing with an esophageal varice, and he's actively bleeding here. And we also see he has chronic portal hypertension with chronic liver disease, spider angiomas, ascites, so he has some little bit of cirrhosis going on here. We want to know what's the best next step when you have someone with esophageal varices and active bleeding. And in this situation, the first thing you want to do is you want to go ahead and administer them octreotide via IV. Octreotide, it's a vasoactive medication that helps reduce portal pressure by causing splanchnic vasoconstriction and decreasing blood flow to the varices, which can temporarily control the bleeding. After stabilizing the patient with vasoactive medication, an upper GI endoscopy with hemostatic intervention to ligate the vessels can be performed to treat the varices. So first you'd want to do administer octreotide, which octreotide is also a somatostatin analog. And then after we've administered octreotide, then you could do D, which would go ahead and go in and ban them. But you need to stabilize the patient with the medication, and then you can go ahead and do an endoscopy and ban them first. Surgical intervention, you really want to wait for cases when endoscopy has failed. So surgery is not your first line. First, you want to give the medication, endoscopy, then surgery. And prophylactic antibiotics could be used in cases with patients with cirrhosis and GI bleeding, but it's not really the first step in an active bleeding scenario. So it's to prevent infection, but it's not something you'd really do in this situation. And E would be something where we have recurrent varices. So if the patient presented with multiple varices that weren't recovering, then obviously your conservative management's not working, and then you'd want to go ahead and put in the transjugular intrahepatic portal shunt, and that would treat the recurrent varices. But in the situation, it seems like it's the first time he's had this, so we want to go ahead and treat with octreotide, and then that would be followed by D. And if the problem didn't solve, we could do E later on, but it's not indicated in this situation because we haven't quite first tried the initial measures. So there you have it. If you like that, go ahead and like and subscribe, and that's it. See you in the next one.